It's almost a too big to fail insurer.
UnitedHealth is a monopoly on steroids.
We look across the whole of United. We continue to be, as always, focused on how we defend and protect the organization.
United. What do you have to say for yourself? This day, this week, this time, you're catching all the smoke. Why? Because you're trending, okay? Because so many things are resurfacing, I am bringing it to you. My channel is just a baby, and I did not post my first video until the first week of October. And now that we are in December, 2 months into my channel, I have quite a bit to catch up on. So again, United, you're catching all the smoke. Earlier this year, there was a hearing with the Finance Committee and UnitedHealth Group's CEO, Andrew Witty, and they asked some questions, and this man was supposed to explain himself, but did so in a very CEO way. That's all I gotta say about that. But I'm gonna bring these clips to you so you know exactly what I'm talking about. Hello, welcome to my channel. My name is Broker Evan Pollard, licensed in life, health, accident, and sickness in both North Carolina and Arizona at the time of this video. United, I would not be talking about you right now had this not occurred, but you know what? It did. So I'm here talking about it. Senator Elizabeth Warren goes in on Andrew Witty, asking him some very important questions, but also bringing up some very important facts as well. Now, quite frankly, because UnitedHealth Group is the largest insurer in the nation, and they're cornering the market in so many avenues that it makes you wonder what's really going on. Let's review what we're talking about here.
Thank you, Mr. Chairman. So, Mr. Witty, in 2023, UnitedHealth raked in a whopping $22 billion in profits, making you the most profitable healthcare company in the country. In fact, by revenue, UnitedHealth is the 11th largest company in the entire world.
I know you heard that. $22 billion in revenue last year in 2023. Now, granted, we are in the last month of 2024, but we will then soon see what their profits were for this year. And I would assume it may be more than last.
Now, Mr. Witty, UnitedHealth Group owns the country's largest insurer, the country's largest claims processor, the country's third largest pharmacy benefit manager, a huge pharmacy chain. It is the largest employer of physicians nationwide, or controller, with at least 90,000 physicians, as you just testified. That's about 1 out of every 10 doctors in the country. Is that correct about your size?
So just to thank you, Senator. As far as the physicians are concerned, we employ just under 10,000,
well,
and
as
the
I
rest
said,
are
I think
affiliated.
you have control over about 90,000.
I would say not controlled. They choose to work with us.
Okay. Great. Because UnitedHealth has bought up every link in the healthcare chain, you are now in a position to jack up prices, squeeze competitors, hide revenues, and pressure doctors to put profits ahead of patients. UnitedHealth is a monopoly on steroids. The opportunities for price gouging are everywhere. For example, UnitedHealth is the biggest participant in Medicare Advantage, the government program that pays private insurers to administer Medicare benefits.
In 2024, taxpayers are spending on average 22% more per Medicare Advantage enrollee. And that is because they are making the enrollees seem sicker on paper than they actually are in person. The Medicare Advantage plans get paid more money for the sicker beneficiaries. Health risk assessments are encouraged at the end of each enrollment. It doesn't matter who you're talking to, whether you're self-enrolling online or you're enrolling with a captive agent or a broker who is independent out in the field like myself, then we all have the ability and option to help you fill out an HRA. Now, with that HRA, that is an assessment to allow the insurer to gauge how much care you may possibly need during that benefit year. And it is also encouraged that you enter in as many health risks as you can to then allow the plan to gain more money within their budget. With this health risk assessment, it does not necessarily affect you as the enrollee, but it does allow the health insurer to gain more money, more federal funding from the government in order to make a higher profit. But more on that in a separate video.
With this web of subsidiaries, UnitedHealth is well positioned to rake in more taxpayer money by using a practice called upcoding to make enrollees look sicker. That is, noticing that a patient has a cane and adding a diagnosis of vascular disease to the medical chart, even if there's no clinical basis for the diagnosis and no treatment planned.
Medicare Advantage enrollees are more than often going to be upcoded or recoded on their healthcare diagnoses versus someone who is on traditional Medicare. Someone on traditional Medicare is likely going to have a smaller portfolio of health concerns written down by the physician themselves.
Mr. Witty, according to a 2019 investigation by the HHS Inspector General, UnitedHealth was far and away the most aggressive abuser of upcoding practices. Do you know how much, according to the Inspector General, UnitedHealth cheated taxpayers out of in 2017?
Senator, thank you for the question. I'm not familiar with that particular piece
The
of work.
number is $3.7 billion, and that's in just a single year, and that's from only 2 upcoding practices. You know, that was 5 years ago. Now, as we speak, is UnitedHealth under investigation from the DOJ for, among other things, your billing practices?
Senator, thank you for your question. We have a long-standing practice of not commenting on matters such as that or things like mergers and acquisitions.
Side eyes, real.
Well, I understand why you might not want to comment on it. Public reporting from the Wall Street Journal confirms that it is, although your company has not disclosed this investigation. In fact, yesterday I sent the SEC a letter raising concerns about over $100 million in stock sales that UnitedHealth executives made in the days and weeks before the investigation was revealed by the press. And I'd like to make that part of the hearing record if I can, Mr. Chairman.
Objection, sword.
Okay, so UnitedHealth is huge, and it boosts its multi-billion-dollar profits with, among other things, illegal billing tactics. And that takes me to the data breach.
When it comes to a data breach of a very large company, you have to have engineers in place working for the company to ensure that there is nothing but optimal security within their data systems.
After the largest cyber attack on the healthcare industry in American history, quote, put hundreds of thousands of healthcare providers at risk of collapse, UnitedHealth is now using the crisis to expand its monopoly even further.
For $3.3 billion, UnitedHealthcare tried to acquire Amedisys, which is its rival competitor in home health and hospice care. The District of Maryland alleges that this transaction would have eliminated competition between the two. Both Amedisys and UnitedHealth have been 2 of the largest providers. United would have had the ability to essentially monopolize that sector, leaving everyone else with no choice but allowing UnitedHealth to be their provider and insurer. Now, with the plethora of markets within the home health and hospice services, that sector alone is proposed to generate at least over $1 billion in revenue per year. Now, there is no wonder as to why United would want to also acquire them and lock in the market.
For example, in Oregon, UnitedHealth tried to purchase a local physician practice, but faced enormous public opposition. After the data breach that we're talking about today, these doctors couldn't get reimbursed for their services, which pushes them to the financial breach. So what did UnitedHealth do? They filed an emergency petition with regulators to allow them to acquire the doctor's practice on an expedited basis. Mr. Witty, will this acquisition make UnitedHealth even bigger?
Senator, thank you for your question. I'd just like to also put on the record that we,
It's a yes or no question.
as an
I
organization,
had a very simple question. Will it make UnitedHealth, this giant, this 11th largest company in the entire world, even bigger?
as new organizations join us, the organization, I hope, becomes better as new
The
physicians, for
question is
example,
not
join. And
better.
What is up with all of the diversion?
We've already talked about your business practices. The question is bigger. Will it make UnitedHealth bigger?
as we grow, we become larger, yeah.
Yeah, okay. So, UnitedHealth is using its own data breach to snap up doctors' practices that have been driven to the edge of bankruptcy by that same data breach. It's no wonder that UnitedHealth told its shareholders that this data breach would have, quote, no material impact on the company's finances. UnitedHealth will stop at nothing to grow bigger, bigger, and bigger as we speak. UnitedHealth is trying to pick the bones of Stewart Health Care in my home state of Massachusetts, which was ruined by private equity and corporate greed. It is time for regulators to say no to these efforts to get bigger and to suck even more health dollars away from patients and providers who need it. For the sake of our patients, our doctors and nurses, and the American taxpayer, it is time to break up the UnitedHealth monopoly.
My colleague has expired. Next, in our conversations, and I gather on an earnings call, you pointed out that when asked about the breach, the cyber attack was paradoxically a validation of the size and scope of United's business practice. I've been told, Washington Post article, that 5% of U.S. GDP flows through United every day.
And as Senator Cassidy said, if 5% of our nation's GDP is flowing through United Health on a daily basis, it poses many questions as far as their reliability, their intentionality when it comes to serving Americans.
Now, yes, but if you read somebody by Nicholas Taleb, he would say that the fact that you're so big and so dominant presents a special vulnerability. And that, yes, you have the deep pockets by which to address this, but the very fact that you're so big means it had a wide-ranging ripple effect that was outsized. And so I think for us, we would have to ask, is the dominant role of United too dominant because it's into everything, and messing up United messes up everybody?
Senator, thank you for the question. I think it's really important to be clear that the change, footprint, and activity was exactly the same on the day it was attacked from before it was acquired by UnitedHealth Group. It didn't change because of UnitedHealth Group.
Yes, but if we try it, but I don't want to limit our imagination to just change. If 5% of our nation's GDP goes through United every day, then is there something else that could be incurred upon United that would have even farther reaching effects?
So as we look across the whole of United, we continue to be, as always, focused on how we defend and protect the organization. We look to how we can upgrade organizations.
Yeah, but that's not my point. My point is the size of United become it's almost a too big to fail insurer. Because if it fails, it's going to bring down far more than it ordinarily would.
I don't believe it is, because actually, despite our size, for example, we own no hospitals in America. We do not own any drug manufacturers.
But don't I know that y'all own like some incredible percentage of physician practices now?
Actually, we employ less than 10,000 physicians. Hospitals across America employ 400,000 physicians. we contract and affiliate with a further 80,000 physicians who voluntarily choose to work alongside our Optum colleagues. So we're very proud of the physicians who work for us, but oftentimes I think people confuse the affiliated and contracted physicians with the employed physicians, where we employ less than 1% of doctors in America.
I'm out of time. Thank you. I yield.
If you are new here, give this video a like, comment, share if you care, and subscribe to my channel for more videos reviewing some news and information regarding your life, health, and wellness. I try not to make it all insurance over here, but that is my industry and my profession. Some would even call me a benefit specialist. But yet again, very interesting information to take a look at. I thank you so much for joining me with my bit of news for today. Granted, it's old news that happened earlier this year, but it's relevant. So let's keep talking about all of the things that you need to know for your health and wellness. And again, if you are currently a United member and you're feeling a little bit weary about being with this provider, please give me a call today. And just like many other Americans right now, some are looking to switch plans. Now, there is an opportunity for you to do so, as we are still in open enrollment for the ACA up until February 15th. But Medicare, please give me a call and I will be able to discuss with you what you are able to do today.